Hello, welcome to the Unritalin Show. I'm Dr. Yannick Poli from unritalinsolution.com. Today, in this episode, we're answering the question, how do we test for ADHD? In a previous video, we discussed how ADHD is diagnosed medically. But again, this was just labeling the behavior into disease. What we want to do is really understand what is going on with the child. So in the Unritalin solution evaluation process, we have 7 levels or 7 steps that we go through in the evaluation process. And the first step is about interview. It's about talking with the parents, with you, with your child, and try to understand what is going on. What is going on in his life, in school, how is it affected, in his social integration, and so forth and so on. We have found through experience also, now there's 10 years that we're working with children like that, is that in the history there's 10 questions that are very, very important to ask. I call them the 10 key indicator questions because those questions can already give us some clues to pinpoint to some of the most common causes of ADHD. Now, if you'd like to get those questions, what you do, you go to our website, unritalinsolution.com, on the front page, and you sign up for a free ebook. Those 10 questions are in the ebook. So go there and sign up after you finish watching the video. So that was level 1. Level 2 is about objectifying the behavior, and for that we can use behavioral skills. So there's a few that you can find for free on the internet. If you'd like to, you can also sign up for Unritalin Solution Starter Kit. You get access to a special part of the website where you can download some of those forms. So it's basically objectifying the behavior. Then in level 3, what we want to do, if necessary, is do a bit more extensive testing on a neuropsychological perspective, testing some different brain function, if necessary, looking at IQ, screening for learning disabilities or dyslexia and that kind of things. Then we go into level 4, and level 4 is all about objectifying attention and impulsivity, because it's not just about appreciating from the outside, but it's measuring the ability of the children to function. And to do that, we use a test called a continuous performance test called Tova, and you can get more information about it on tovatest.com. Then we go in level number 5, and this is really trying to understand what is going on in the child. So we do a very, very comprehensive physical exam as well as neurological exam. And we're not looking at frank pathology like a neurologist would do. We're looking at subtle difference in brain activation. And the best trained practitioner that you can find for that is a chiropractor trained in the field of functional neurology. So if you want more information about that, you can go on our website as well. Now there's some more sophisticated ways to measure how the brain function and the differences that children with ADHD have. For example, quantitative EEG is another option. Another one is some what's called SPEC, is looking at how your brain activates. It's a more invasive things. You may have heard of the work of Dr. Daniel Amen, but this is more expensive and more aggressive type of diagnosis, if I can say. But just looking at how the brain function, if you find a good chiropractor trained in chiropractic functional neurology, that will help a lot. Then level 6 is about basic blood work. There's a few things that we have to look at. For example, we have to look at the metabolism of iron. There's some studies from France that show that 75% of kids with ADHD have anemia. They have problems with iron, and iron is a very important mineral to help the production of dopamine, which is the main neurotransmitter involved in ADHD. And then in level 7, we're going about more advanced, what we call functional testing. We can be looking at, is there food intolerance, is there deficiencies in essential fatty acids, is there toxicity in the system, do we have some gut problems with bacteria and toxins that affect the brain, and so forth and so on. So, as I said, it's not important just to label the behavior. It's important to really understand what is going on, and this is why we need a very comprehensive evaluation of the child. We'll talk more about it in our series of videos here, so stay tuned, and if you want more information, check out our website. I'll see you soon. To get 20 more videos like this and 2 great free bonuses, visit unritalinsolution.com/free.